Hello everyone, my name is Bidhata Khatri. Welcome to FIP CPD Bite on the role of health literacy in self-care. With today's episode, you will be able to learn what health literacy is, its components, and impacts on desirable health outcomes. You'll be able to learn about the drivers and barriers of health literacy. You'll also learn how pharmacists may support their community in using reliable and evidence-based information effectively. Even the best health information cannot help if people do not understand how to act on it. Taking care of our health is part of everyday life, not just when we visit a doctor, clinic, or hospital. Health literacy can help us prevent health problems, protect our health, and better manage health problems when they arise. Health literacy is the patient's ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Health literacy is strongly associated with patients' ability to engage in complex disease management and self-care. Patients unable to appropriately interpret health information are more likely to be admitted for extended hospital stays, experience avoidable readmissions, and undergo unnecessary emergency care. Some of the examples of health literacy include knowing how to fill out forms in the hospital, comprehending lab values like cholesterol or blood sugar numbers, understanding role of diet and exercise in diabetes so as to prevent complications like diabetic foot ulcer, and being able to have good self-care. Health literacy affects how well people can access medical services, care for any dependents, and conceptualize their own health risk. People with low health literacy often also have misinformation about what causes disease and what can prevent it. That can mean poorer health outcomes. Health literacy is affected by various factors. Age is one of the major factors. Studies have shown people aged over 65 years have low rates of health literacy. Or decline in an older adult's cognitive ability could contribute to an older adult's ability to comprehend and recall new topics. Physical impairments such as hearing and vision loss may also contribute to a decreased ability to process health information. Education is another factor that affects health literacy. Higher levels of education are associated with high rates of adequate or better individual health literacy. People with more education are more likely to learn about health and health risks, improving their literacy and comprehension of what can be complex issues critical to their well-being. Education promotes health literacy by providing individuals with the necessary knowledge, skills, and confidence to make informed decisions about their health. It empowers individuals to access accurate information, engage in preventive behaviors, understand medical conditions, communicate effectively with healthcare providers, think critically, advocate for their health, and address health disparities. Disability is another factor that affects health literacy. People living with disability may be at risk of low individual health literacy for functional reasons such as poor vision or cognitive impairment. Due to reduced communicative and cognitive abilities, reduced reading and writing skills, and reduced self-perception, people with disability often have limited access to the resources which are needed to acquire knowledge of health-related subjects and to appraise and apply health-related information. Low income is another factor that affects health literacy. People with low income are more likely to have limited literacy skills because these individuals often do not have regular access to the internet. Even people who read well and are comfortable using numbers can face health literacy issues when they are not familiar with medical terms or know how their bodies work, when they have to interpret statistics, or when they are diagnosed with a serious illness, or when they have health conditions that require multiple complicated self-care. Limited health literacy can result in many things like more likely to have unhealthy lifestyles such as lack of exercises, lack of nutritious diet, less likely to engage in preventive programs such as vaccination services, mammogram test in case of early cancer detection, less able to manage long-term conditions such as diabetes and hypertension. The patient may fail to recognize side effects or drug interactions. There might be confusion about appropriate responses to public health emergencies such as COVID. Similarly, it also might result in increased visits to the emergency room by the patients, increased hospital stays, less likely to follow treatment, and higher mortality of the patients. Limited health literacy has been associated with non-adherence to treatment plans and medical regimens, but pharmacists play a major role in medication adherence. When asking if a patient is taking their medication, it is important to evaluate the reasons why they may be struggling to stay adherent. Patients with low health literacy may not be taking their medications because they do not understand their disease state or what the medication is for, even if it was already explained to them in their doctor's office. Additionally, these patients may feel too embarrassed to disclose why they are not taking their medication. It is crucial that pharmacists exhibit empathy and a non-judgmental attitude in order to build trust and open space to address health literacy issues with their patients. Health literacy is important for various people such as consumers, healthcare professionals, and policymakers. It is important for consumers because it affects their capacity to make informed decisions and take action to manage their health, including self-care. It is important for healthcare professionals because it affects the way they manage their communication and partnerships with consumers and provide care. And many times, consumers depend on health information to the healthcare professionals. And it is essential for policymakers as well because the complexity of their systems can affect consumers' ability to navigate health services and systems, collaborate with organizations, and engage with their care. There are various barriers of health literacy. Some of the major barriers are cultural barrier, language barrier, financial barrier. Studies have shown cultural barrier as one of the major barriers of health literacy. In addition to communicating effectively, considering how cultural and religious behaviors might influence a patient's health is also important. Practicing cultural humility by asking patients about their beliefs and customs and employing trained medical interpreters or support can help integrate these principles into everyday practice. Language can be a barrier as well for the consumer to understand the health information. There is a need to invest in interventions that improve inclusive health communication to help users to actively engage in decision making about their health. This includes the development of health literacy tools, training healthcare professionals, allocating funds to health literacy activities. There can also be a barrier when health professional education and health literacy public health issues are limited. And sometimes even the healthcare system might not be attentive to health literacy and it can act as a major barrier. Healthcare system which has a poor organizational commitment and does not have policies and procedures supporting health literacy can act as a barrier. This prevents patients from being engaged in preventive activities. Limited health literacy costs the healthcare system money and results in higher than necessary morbidity and mortality. Health literacy is a two-sided issue comprising both an individual's ability to understand and use information to make decisions about their health and care, and a systems issue reflecting the complexity of health information and the healthcare systems. Adults with limited literacy or health literacy report feeling a sense of shame about their abilities. They may hide their reading struggles from everyone, including healthcare providers. There are, however, informal ways to identify people with limited literacy skills. Some common signs are fills out forms incorrectly or incompletely due to less understanding, misses or delays follow-up visits due to less understanding of the importance of follow-up, has difficulty following instructions, does not know the name of the medication but rely instead on shape, size, and color, has difficulty interpreting signs and symptoms of common ailments or low ability to identify the appropriate treatments and measures to take to manage such health situations, has a low understanding of the impact on health of unhealthy lifestyles and behaviors and how to adopt healthier behaviors to prevent disease, struggle to provide a coherent sequential medical history, use statements such as I forgot my reading glasses, I'll read through when I get home, or I'm too tired to read when asked to discuss written material, Some of the techniques that pharmacists can use are speak in a plain language and avoid technical terms such as edema and use swelling instead of using word screaming. Pharmacists can use word test. This also includes using familiar words and short sentences and providing clear, simple explanation for unfamiliar terms. Pharmacists can use active voice, short sentences, and clear headings to make messages easy to read and understand. Pharmacists can also use visuals such as pictures, graphs, and icons to reinforce messages and illustrate concepts. This is also a place where visual aids can be helpful. Visual aids and picture-based education sessions can have some of the profound impacts. Some patients will have language barriers, have trouble reading a prescription label, or struggle understanding instructions. This is where visual aids can help knock down that barrier and lend itself to more impactful communication. The pharmacist can focus on key information needed for the patient visit first and then let the most important points come first and ask open-ended questions. The pharmacist can encourage patients to write down their questions before their visits and work together with patients to set goals and make shared decisions. This is useful, especially in case of complex diseases which has more than one treatment options available, and there are toxicity and adverse drug reactions as well involved with the treatment options available. And pharmacists can distribute plain language educational materials and connect patients with supportive resources such as advocacy groups which advocate for specific disease. The pharmacist can ask patients to share information learned or plans made by teaching them back to you. Teach back has three steps: explain the health information, check for understanding, and re-explain the health information if needed. Some of the evaluation criteria for the URL or domain are accuracy, authority, and bias. And some of the common domains available are .com, .edu, .org, and .gov. While checking the website, we should always check the contact information and about us provided in the website. .com is one of the most common domain and it signals a commercial website. This is usually a website for a business or service and its main objective is sales. It should be used with extreme caution beyond basic information such as contact information or vision statements. .org are organization websites usually for member organizations or non-profits. Even .org sites should be used carefully. Many are biased towards a specific agenda they are pushing, and sometimes for-profit groups have a .org address. .edu signals a page from college or university website. Most .edu websites are considered reliable for research, but privately owned pages from faculty or students might contain inaccurate information. .gov are websites which are from the government. Even .gov websites are generally accepted for academic research paper, but you should be sure to check if any vetting process has been imposed on given reports. We should always check at the content and judge the website based on the content. And also while checking about the website originating from other country, we should make sure that the treatment option available in other country is available in the same country as well. And contact information and about us should be checked thoroughly. And the more information an author provides about him or herself, the better. And in About Us, always we should try to find the About Us link to determine the authority and agenda of a particular site. While evaluating online health information, we should always keep in mind if the information has medical research backing it. Can the information be verified from multiple other sources? Who published the page and what are their qualifications? And when was the information published? And is it showing any bias? Is the author trying to promote a product? We should check all these things while checking our website. So to conclude, I want to say that nearly 9 out of 10 adults struggle to understand and use personal and public health information when it's filled with unfamiliar or complex terms. Limited health literacy can cause worsened health outcomes, strain the healthcare system, and create additional costs. Pharmacists should always use plain language, everyday words, no technical terms while counseling the patients, and focus on key messages. And teach back method is a good method to use. When looking at information online, make sure that you can verify it from multiple sources. Check online health information websites that are ad-free, fact-checked, and updated.